How do you know if you have AVN, how it is diagnosed, and what can you do to prevent it or slow it down? These are the questions which I'm going to cover in today's video. Hello friends, I'm Dr. Pankaj Walecha and I'm a hip and knee replacement surgeon in New Delhi, India. So let's understand AVN in details. How do you know has two components to it. So the first component is how do you know? If you are experiencing pain in the hip region, which is frequent, which is an everyday pain, you consume painkillers on regular basis, then probably your hip pain needs medical attention. Also, by your medical history, if you are consuming alcohol every day or on a regular basis in high quantity of poor quality, bring everything together and your chances of developing AVN increase. If you have had any fracture in the hip due to a road traffic accident, due to a fall or any such reason, then there is a probability that the blood flow to the femoral head has reduced and you can develop avascular necrosis. If you have consumed steroids for any reason, be it for a medical condition or for any vague reason like gaining weight, then steroid intake can also lead to AVN. The most common misdiagnosis of this pain is sciatica. I think my nerve is getting pulled. I think I have a pinched nerve in the back. At a lot of places, even doctors think that it is sciatica until and unless the index of suspicion is very high. So if a patient, youngster especially, between 20 to 50, if he comes to me with pain in the groin, pain in the side pocket, or sometimes pain in the buttock, also for pain in the knee, I suspect AVN all the time. And how do we diagnose it? That's the second part of it. The gold standard investigation to diagnose AVN in early stage is MRI or magnetic resonance imaging. It's a very, very commonly performed investigation in all the cities. Just by doing one MRI, you can diagnose AVN even in stage 1. And the earlier we find it, the higher are the chances of saving your natural hip. The earlier treatment is started, the higher are the chances that you may not require a hip replacement surgery in future. But if you are already coming to us when you are limping, when your movements are restricted, when you cannot ride a bike, when you cannot walk long distances, just by doing an X-ray, we can figure out that it is AVN. Because the X-ray shows that the ball of the femur, this ball has collapsed and it shows on the X-ray. Even my patients can pick it up themselves. Then by your clinical history, by your examination, and by doing proper investigations, we diagnose AVN. So that's how you know if you have AVN or not. And the third part is how it can be prevented or how it can be slowed down. Now, prevention is one thing. If you have come to me in stage 1, then medications can actually resolve the swelling inside the head of the femur. Now, what happens in stage 1? The head has not collapsed. The bone has not become damaged. There is only swelling inside the ball, which is visible only on MRI, X-ray cannot pick it up. When we see that, medications or in carefully selected patients, we decompress the head, which means the pressure inside the head of the femur is so high that the blood which is flowing from here into the head has blocked. If we relieve that pressure by a surgery called core decompression, then the blood flow can be restored. Mind you, very few patients benefit from core decompression surgery and we choose our patients very, very carefully. We have seen stage 1 patients benefit the most out of it. In majority of the patients who are in stage 2, where the head has not collapsed even now, medical treatment can help. And you can go and discuss the medical treatment options with your doctor. So the first thing in prevention is to diagnose it early. What are we trying to prevent? We are trying to prevent the progression of the disease, slow down the progression of the disease. And stage 1 patients can go back to normal life. A lot of stage 2 patients also go back to normal lives with medical treatment. So early diagnosis is one. Point number 2, if you consume alcohol on regular basis, please stop doing that. If you are experiencing hip pain, if you have AVN, then alcohol is going to damage your hip at a very rapid rate. And if you are consuming steroids for non-medical reasons, you should stop doing it gradually because we do not stop steroids like immediately. Weight reduction also helps a lot of patients. Now, a lot of AVN patients says, I can't walk, then how do I lose weight? So there are multiple things which you can do, which are of course dietary. And as you take medical treatment, with medications, when your hip pain reduces, you can try and reduce the body weight also. But till that time, do not at least gain weight. And all these things put together will help you in preventing the progression of the disease. So I hope in this video you got the answers to all these 3 questions. And if you have any further questions on it, you can drop it in the comment section and we'll get back to you. Thank you so much for watching.